Hi again, and welcome to Tiny Matters with Dr. K. I am Dr. Kutso Sibitsiba, a pediatrician, a parent, and someone who knows just how frustrating it can be when it feels like your child seems to catch every bug around. Today, we're tackling a question that many parents ask, sometimes in a panic, sometimes with a little bit of frustration. Why is my child always sick? It's not just about germs. Sometimes it's immune systems, daycare, allergies, and nutrition, and our expectation of what is normal. Let's start here. Children that attend daycare under the age of 5 can catch 8 to 12 infections in their first year of creche, all viral, all normal, in a healthy child with a normal immune system. It's not a problem. The immune systems are still learning. Now let's take a closer look at the kind of conditions that can make your child prone to recurrent illness. They range from common and manageable to rare and more serious. Number 1, creche syndrome. This is a real phenomenon. Children newly exposed to group settings like daycare tend to catch many infections in the first year. This usually settles as the immunity builds. Number 2, allergic rhinitis. Often mistaken for constant colds, allergic rhinitis can cause year-round nasal congestion, sneezing, and post-nasal drip. It may respond better to antihistamines, definitely not antibiotics. Number 3, reactive airways or childhood asthma. Some kids cough and wheeze with every single cold. These symptoms may point to asthma or airway hyperreactivity, especially if there's a family history. Number 4, iron deficiency. Low iron levels weaken the immune system. Children with poor diets, picky eating, or chronic illnesses may need to get tested and treated. Number 5, immune deficiencies. Rare but important. Signs include serious, recurrent, unusual infections and a child that is not growing properly. These children need specialized care and testing. Let me tell you a story. I once saw a 4-year-old who had been sick every single month for a period of a year. His mother was emotionally and physically exhausted. He was having ear infections, he had eczema, he had a runny nose all the time, and this cough that just wouldn't go away. He also was really small for his age. On further testing and family history, it turned out this poor little guy had allergies. Once we treated his allergies, his growth became on track and his infections went away. As a parent, here's what you can do. Number 1, keep a health journal. Oftentimes when kids are sick, it just feels like the illness is recurring and overlapping. A health journal helps us to record when and how long the symptoms lasted. Number 2, always check your child's growth when you go to the doctor and ask the doctor if the growth is on track. Number 3, check the environment. Is there dust, damp, or smoke? Air allergens are a huge trigger when it comes to respiratory symptoms in children. Number 4, focus on good nutrition, hydration, and plenty of rest. And lastly, ask yourself, is this something new or part of a pattern? This is where your health journal comes in. While frequent infections are normal in young children, these are red flags that signal the need for further evaluation. Poor weight gain or stunting, needing multiple courses of antibiotics quite frequently, recurrent chest infections or ear infections, infections in unusual sites like bones, liver, or brain, symptoms that don't fully resolve between illnesses, more than 2 hospitalizations in 12 months, and severe reactions to routine infections. If any of these are present, it's worth asking your healthcare provider to investigate further. This could include an immune workup, chest x-ray, or even allergy testing. So if you're feeling like your child is always sick, you are not alone. Sometimes it's normal, but sometimes it's not. Either way, you need support, answers, and someone who takes your concerns seriously. Thanks for tuning in to Tiny Matters with Dr. K. If this helped you feel less alone, share it with a friend who's also been worried. Until next time, stay kind and stay curious.